Thank you for having me. Yeah, so I'm Evelyn Frederick. I'm a second year family medicine resident. I work mainly over at Family Medicine, seeing patients weekly, but then float around the whole area and I go in the hospital. So I'm sure I've seen some of y'all everywhere. Um, but yeah, we're gonna talk about sun safety. I'm originally from San Diego, California, so I have a lot of exposure with sun throughout the year. So, and then also just moving up to Boone, it's a different environment. So thinking about how to change my sun routine kind of in different atmospheres. So um, glad we're talking about it today. And let
Yeah.
me make sure I can figure out how to share my screen.
Oh, yeah. You take your
Not,
time. Let me know if you need any help.
can everybody see this?
I can see that. Yes, you got
Okay,
it.
that easier than I thought. Okay, so we're gonna talk about skin cancer and sun safety. Kind of a really big topic. So it's really hard to do in kind of an hour. So I chose big highlights. The first thing we're gonna just talk about, move slides.
You got it?
Hold
Try,
on.
try clicking your screen. Click your screen.
Oh, okay, does that matter?
Here it goes. Yes.
Okay, there
You
we go.
see, you
Okay.
see it says why sun safety matters.
So we're just going to talk in general. I just tried to pull some statistics about skin cancer and why sun safety matters. So skin cancer is by far the most common cancer in the United States. About 1 in 5 Americans will develop skin cancer in their lifetime. So that means about 9,500 people are diagnosed with skin cancer every day. So
Crazy.
it affects kind of everybody. The worst part, kind of, there's different types of skin cancer we'll get into, but the most dangerous one is melanoma. And more than 1 million Americans live with melanoma. And invasive melanoma, meaning more dangerous, going other places, is projected to be the 5th most commonly diagnosed cancer for both men and women this year. Um, and
I
then,
did not know these statistics.
mhm,
That's
yeah,
crazy.
yeah, it's a huge, it affects everybody, like regardless of skin color, gender, or age.
Mhm.
Um, So it's really important that everybody kind of thinks about this because it is just so common. Um, and women will have a greater incidence than men for different reasons. Women are more likely probably to go out there and tan and be sun exposed.
Mhm.
For NMSC is non-melanoma skin cancer. White populations have a higher rate of melanoma, has a lot to do with just like genetically born with less melanin, which gives skin color.
Mhm.
Um, but on the flip side, patients with darker skin tones may not be diagnosed until later stages, so it's more difficult to treat. So there's also some kind of disproportionate diagnosing. So it's even if you think you have some kind of built-in skin cancer protection with maybe your skin tone, um, still important to look and get spots checked out just so it's not more difficult to treat later down the line in all ages, so kids and adolescents. And I have a whole slide, and we'll talk about child care for sun exposure, but still about 300 cases of skin cancer diagnosed in children under 20 years of age. So that's not insignificant, but um, and then
Makes me
why
sad.
all this matters is because all of this is um, the risk can be reduced just with kind of some daily basic skin protection. So about 90% of non-melanoma skin cancers are associated with UV exposure from the sun. And if you just use regular minimal SPF 15 sunscreen, you can reduce your risk of developing like squamous cell cancers by 40%. So just going out every day, just putting something on my face, I can help reduce this risk of skin cancer. Someone who is a white woman, where I'm a little bit more prone.
Right.
So we can't get through this without talking a little bit about the skin. I promise there's no quiz. And this is nothing. This is just because it's a big organ. It's your largest organ in your whole body. Um, and there are 3 main layers. There's the really top layer, which is the epidermis. I don't know if anybody can see my pointer, epidermis. And then you have the dermis, which is where all your blood vessels, hair follicles, sweat glands, all that fun stuff lives there. Then you have the hypodermis, which gets into the fat kind of underneath the skin.
Mhm.
And the top layer of the skin, there's multiple layers. And that's where a lot of our skin cells live. Thinking of squamous cell, basal cells, and then melanocytes, which produce the melanin, which is kind of our skin color spectrum, right, from very pale to darker skin tones. And the skin's got a bunch of function. So it does temperature regulation with sweating, can help with sensory perception, so temperatures, fabrics on skin. It can excrete waste, helps you sweat. Sweating helps release or to excrete the waste through sweat. It can absorb medicines or the sun. The biggest thing, though, that it does, it's your first level of protection. So it protects you from bacteria, helps reduce trauma to the body. And then the biggest one is UV radiation, right? So it's going to absorb, but then the skin's job is also to kind of help protect us from when the sun is hitting our skin.
Yeah.
And that does that through the melanin. The melanin in their skin kind of helps reduce that risk, or takes on and absorbs all that UV exposure.
Yeah.
And we'll go through that a little bit more. And when you come see me or other doctors, we kind of think of skin kind of on this thing called the Fitzpatrick scale, which is down in the bottom right corner. And there's 6 different types. Thinking about someone who's really fair skinned, red hair, and then kind of going up through the gradient to someone who's got really dark colored skin, black hair. And all of that is to deal with the type of melanin. So the lighter you are, the less melanin you have in your skin naturally. And then up to like type 6, who have the most amount of melanin. It's important because thinking of the melanin protecting your skin, those who are type 1 are very UV sensitive. So they burn basically and never tan. Up to
That would be me.
6. Yeah, I'm a type 2. There's actually a fun little quiz you can do on your Fitzpatrick scale. So you can basically just type in Fitzpatrick scale quiz. I really like the Skin Cancer Foundation's like Fitzpatrick scale, but ask you questions on like your hair color, your eye color, what happens when you tan. Just helps give you kind of like rationing out through kind of the spectrum.
I will be doing that after this talk.
Yes, it's actually pretty fun. You learn a lot about your skin type 2 and kind of what works best and how you should protect yourself from the sun. It's actually really informative.
Yeah.
But then the more sun sensitive you are, that just increases your skin cancer risk to type 6, who has the least amount of risk just kind of innately.
Yeah. I think it's I'm sure other people on this call would agree that it's easy to sometimes forget that your skin is an organ and that it's your largest organ. It's just kind of easy to forget that. And I feel like we do a lot of conversations, or we have a lot of conversations about caring for our health and our other organs. And I think sometimes the skin is just not focused on as much. Yeah. So that's interesting.
All right, so we're going to talk now. We'll transition to skin cancer. So just in general, skin cancer is just when those skin cells just start to grow out of control, and there's not like the checkpoints in the body that normally stop it. And as they just kind of proliferate and get bigger and bigger, it can branch out and start to destroy body tissue. The name of the skin cancer gets named for the cell that the cancer begins in. So kind of like I was talking about, this is a less friendly picture of the top layer, or like the layers of the skin. So that, again, that epidermis is where most of, like, there's a bunch of different cells in there, but that's where like our squamous cells live, our basal cells, which live kind of down here at the bottom, and then our melanocytes, which have that melanin. So if you get a change in a basal cell, and that's the cell that starts to grow and grow and grow, then you just have a basal cell carcinoma or basal cell skin cancer. And there are multiple types: basal cell, squamous cell, and melanoma, kind of the 3 most common, most heard about. But then there's others: Merkel cells, sebaceous carcinomas, and dermatofibrosarcoma protuberans, which is really fun to say. But those 3, especially Merkel cell, has actually shown kind of a rise recently, but they're definitely more rare. So I'm only going to spend kind of the next few slides talking about the 3 most common, but know that these aren't the only skin cancers that are out there.
Okay.
So basal cell, most common, like we talked about, just comes from the basal cells in your skin, and it develops after frequent sun exposure or tanning. And because it's your sun exposure, it's most commonly on the head, neck, and arms, just thinking of places that are most generally exposed to the sun. And they can grow deep into the skin and cause damage. This is the slowest growing of all the skin cancers. So if you catch it early, there's actually a really great cure rate. The tricky thing about basal cell carcinoma is it can look like a lot of things. So it can be a flat, firm, pale yellow area that's new on the skin. It can be a red raised patch that can be
Mm.
itchy. Thinking of small, like shiny bumps on the skin that can sometimes be flesh colored or pink or red. You can have areas that are just kind of growing and they have raised edges. And kind of the one I see a lot of time most common is people come in and will tell me, well, this just won't heal, or it heals and then it comes back. So thinking of all these lesions that just kind of don't heal, or then like they'll maybe heal for like a few weeks and then come back and they're open again. And then any like injury that's like if you just accidentally bumped your arm or something and it was over one of these spots and it started to bleed.
Yeah.
I just chose a few pictures. Like if you just Googled basal cell carcinoma photos, it's overwhelming and they all do look very different.
Mhm.
This one on the top left is a basal cell on top of the upper lip. You can see how it's kind of got some shininess. It's just a clear, like distinct bordered raised lesion. And then this one on the right is also on the skin cheek, again raised, and it's just really shiny.
Hmm.
This third one is a kind of just an irritated patch, just kind of looks flaky and red, but not so much defined like the top two. So it looks drastically different than the top two, but also just another like example of basal cell carcinoma.
Mm. So let's say someone is listening right now and they're like, oh my gosh, I have one of those on my cheek. Um, they're able to come to you. They're able to schedule an appointment with you at Family or any of your
Yeah,
fellow colleagues. And you all
absolutely.
would be happy to see them and check that out. And hopefully it's nothing, but
Yes.
be able to kind of help confirm
Mhm.
where it is or okay,
Yeah,
cool.
so you can see like there's 15 other residents at our clinic plus all our faculty. So at Family Medicine generally has some availability you can get into and get things checked out when you're worried. We also have like a procedure clinic specifically where there are longer appointments where we can look at the skin and if there's something concerning, just go ahead and take a quick biopsy. Um, Super easy thing to do in the outpatient clinic setting to come get anything on your skin checked out.
Okay, and now let's reframe this thought again. What if someone's sitting here listening and they're like, oh my goodness, my spouse or my parent or maybe even their child has something like this? Well, okay, wait, let's rewind. Let's say it's your spouse. How do you kind of have that conversation or with another loved one, let's say? How do you kind of say you need to go to App Family and get this checked out without it sounding frightening or judgmental? Do you have any recommendations for that?
I would hope it would never. I think anybody come and get a skin checked out, I think just in general, like, hey, I'm worried about this one spot because it doesn't look like everything else on your skin. You know, this one looks a little different than all your other moles. Just kind of like a general term, not that you're judging what the lesion looks like, but I
Right.
think anytime someone's concerned about the skin, they should just kind of use, hey, this one doesn't look like everything else on your body. I
Mm.
think you should get this checked out, or I'm concerned because it's been here, and it's not going away or it's not getting better. I think kind of just using general, like, I'm concerned for you.
Yeah.
Um, and even if, and I'm totally fine having someone come in, a spouse come in, I get all the time, like, oh, my wife just told me to come here, but then ends up being something. Um, so I would just kind of use like, hey, I'm concerned for you. And I think maybe after this, like, there's ways to look and see if a lesion's concerning. So you can always be like, hey, this has changed. I learned this, or I read this somewhere that this could be a sign of a skin cancer. I don't think there's an easy way to to make it not scary when someone brings up that this is a concern, but I think the best part with skin cancer is that if it's caught early enough, there's usually something really simple and easy, and it
Yeah.
it usually has a good response and outcome.
Yeah. Awesome.
Okay. Okay, so after basal cell, kind of the next most common type would be squamous cell carcinoma. So again, it comes from those squamous cells. Also, still on the most commonly on the sun-exposed surfaces. Thinking of arms, chest, back, neck, face, rim of the ear. Most people don't look at their ears, or especially behind the ears. So we'll talk about like skin checks, but getting a family member involved is really helpful because they can look at the places that you necessarily can't.
Hmm. Hmm.
Um, Skin cancer or squamous cell does have the potential to go other places. It's called metastasizing when it goes another place. But again, it's not the fastest growing skin cancer. And this one can also look like a bunch of other stuff, right? So it can still look just like a rough scaly patch on the skin. Again, it can be another raised growth lump. Again, thinking about those open sores that heal and then come back or don't heal at all. And then it can also be wart-like. So think of anything, there's a big wart or a wart that kind of keeps growing. Thinking about that maybe being not just a wart. Sometimes it can be on little stalks too. This is what kind of on the top of the head in someone's scalp. You can see it's just kind of this flaky red surrounding little like flatter part on the top of the head. And then this one here is on the tip of the nose. Again, thinking of kind of that red scaly lesion. This looks a little ulcerated, so like it's not healing very well. The next thing I want to talk about is that these squamous cell carcinomas can develop from a precancerous growth. So kind of even more common than skin cancer, thinking of things called actinic keratoses. So they're not skin cancers, they're just precancerous growths. So when you catch this again, you don't have skin cancer. It's just something that could, if left alone, develop into a skin cancer caused by too much sun. Usually people with fair skin, and again, found on places that have lots of sun exposure, the head, neck, arms, and forearms. These are usually dry, scaly patches or spots. And sometimes you can't even see them, but you're just like rubbing your hand over your arm or through your scalp and you just feel a little rough spot. Those are kind of something to come get checked out too. This one's one on the hand. You can just kind of see all these little rough patches like right here, all these little precancerous growths. Same thing on the top of the head. Most of the time, these can be treated with like freezing. If there's only one or two, you can do something called cryotherapy. If there's a bunch of them, like it's covering your whole arm or your whole head, there's creams that can help kind of treat them a larger area. Those just cause a lot of skin changes, like killing all the lesions off at once. So I wouldn't plan that right before a vacation just because it takes a little bit to heal from that. But these are also things to look at and still can be found on skin checks, or if you find something super easy, you're seeing your doctor, usually can just freeze them off for the most part.
And you're able to do that too? You all are able to do that? Okay, cool.
Oh yeah.
Awesome.
And then the last like specific cancer we'll talk about is melanoma. So this is the most serious skin cancer. This because this skin cancer has a tendency to spread quickly. So this one is the one that if you're going to find a skin cancer, this is the one you want to find early. You want to diagnose it early and you want to get treatment as soon as possible just to prevent that spread. These come from the melanocytes, right? So these are the cells that cause your skin to be the skin color. So usually melanocytes are darker colored, not always, but usually there's a dark color to them. Thinking of everything on the exposed skin, arms, back, face, and legs. I will say all skin cancer can be in places that are not exposed to the sun. So whole body skin check is still important. It's just more common on the sun exposed areas.
Right.
Melanoma can be real tricky, real sly. It can live within a mole that you already had. And then all of a sudden that mole looks a little different, or suddenly it can be a new spot on the skin. And these look like new dark spots. Any spot that is changing in size, shape, or color. Again, areas that aren't healing. You want to look at the skin. Maybe the mole itself looks okay, but the skin around the mole is starting to look a little different. And then any spot that's kind of like itchy, painful, or kind of just tender to the touch are things to come get checked out too.
Yeah.
So this is kind of like and we'll go through on the next slide, things that can clue you into melanoma. But this one's kind of a dark raised. It just looks funky. We call it like the ugly duckling sign, which is something that looks not right or kind of looks different than anything else on your body. Is kind of a good way to approach skin cancer, but specifically melanoma, just that doesn't look like everything else around it. That doesn't look like everything on my body.
Yeah.
But this one has irregular borders. Melanoma can live under the nail beds. So you can look under your skin if you start to see dark spots in your nails, things to come get checked out. This isn't a toenail. Just more examples of kind of like this one, kind of this whole pigment, like a little patch over here, and then this one that's kind of long and irregular shaped. Things that make you more curious if this is like not a normal mole. And so we think about knowing your ABCDEs of melanoma. So, and we'll go through the pictures and then we'll like a real life example. So A is for asymmetric. So does this, if I were to draw a line straight down a lesion, does it look the same on both sides? If it's different, that's concerning. Borders is B. So does the edge of the mole look irregular? Does it look blurred or notched or ragged? So basically anything that's not perfectly circular or symmetric all the way around is concerning. If there's more than one color, so usually moles, if you look at one on your skin, it should all be the same color. So I can look at this one on my forearm and it's all brown. Same thing with everything else in my forearm. But if you ever get one that's like tan with some brown or some brown with some pink or red or something in between, kind of a hodgepodge, then that's a little bit more concerning. Diameter, so if it gets bigger than 6 millimeters or 1/4 of an inch, basically about the size of a pencil eraser, the larger it gets, the more concerning it is. And then if it's evolving, so changing over time. Has this mole changed in weeks or months? Is it changing in size, color, shape, height? If it's growing taller, if it starts to become itching, not itching, or anything else. So those are the A, B, C, D, E.
Yeah.
Asymmetric, border, color, diameter, evolving. And this is kind of what it looks like just on normal actual skin. So if you look at the top, that's non-melanoma all the way across, and the bottom is melanoma spots. But like if I drew kind of like in half either way, it's about the same border in every kind of quadrant. But if I come down here, this is more narrow and taller, where this is more kind of circular. So this would be concerning. And then this border, so this border is even all the way around. And then down here you have notching. It's kind of blurred out over here on this side.
Yeah.
Color. This is all one color. And then down here you've got some tan in the middle, maybe some darker over on the left. Same thing on the right. It's more than one color, and it's big, which is the diameter. So like this one's massive. If I saw that, I'd be a little bit more concerned. And it's so dark, and it's around a mole that maybe was there the whole time, and now it's changing. Where the one on the top is smaller, maybe not 100% regular, but it's smaller. And then if you compared this mole, say this mole was here, you know, my whole life, and then over the next 3 weeks it changed and it got larger in size, then I would want to come get that checked out, even if it's been there my whole life. Now it's different. So now you want to get it checked out.
Yeah, I definitely think it's worth it just to go get it if you just don't know, you know? I'm sitting here thinking that, I mean, I have a handful of freckles myself, but I know some people just have multiple freckles and moles, and it'd be kind of hard. It's kind of hard to monitor all of them. Or sometimes you look at them and you're like, has that one changed? But it's worth it just to go in and see you and just, you know?
Yeah, it's a peace of mind thing. Just
Yeah.
we have like, I'll show you a little picture, but we have special tools that we can look at to look at the mole kind of at like a deeper level, like on a microscope, so we can really see any other changes that can help us clue it in if it's something that's normal, it's just a normal change that looks different, or it's something different that needs to be kind of sampled.
Right.
Okay. So I think that was all about the skin cancers. Now we're going to kind of talk about why we detect them and what we can do to help reduce the risk. So why early detection matters. So I've kind of said multiple times, if you find these early, super easy to treat. Highly treatable, high survival rates if it's detected early, like above 95%. So if you find something different, the soonest you can get in, just to get it looked at and take it in a biopsy if needed, the better. And then the vast majority of these skin cancer deaths are from melanoma. So again, if there's anything dark or changing, new, the sooner you get that looked at, the better. And that is all for the melanoma to reduce the risk of it spreading. So if you look at someone who got diagnosed with melanoma and it hadn't gone anywhere, hadn't touched a lymph node or anything, it's about a 99% 5-year survival rate. But say someone got kind of let this like new lesion sit for a little bit, and then it had spread to a lymph node, the 5-year survival rate goes to 75%. And then if it spreads further than lymph nodes that are close to it, for other organs, it's only a 35% survival rate. So like these stats they've studied just show you like the dramatic decrease in surviving a melanoma the longer it kind of is allowed to live in your body.
Wow.
So if we get these treated early and early detected, less aggressive treatments, sometimes just taking the biopsy in the office can sometimes get most of it, and then just need a little bit more to remove anything less left over, versus the larger the area, the more we just have to kind of essentially cut out. And then the less aggressive treatments just improve cosmetic results, especially if something is on the face. It can be easier to heal, or less of a surface area to scar. So, which can just help people feel kind of just there's an emotional toll of being told you have cancer and then having to maybe have a scar afterwards. It's just a little bit better if it's able to heal a little bit nicer.
Yeah. Oh yeah.
Okay. Okay, so again, just a whole slide on when to be concerned about something. We've talked about all of these, but new growths, anything that's red or irritated, anything that's scaly and red that bleeds or crusts open sores that heal or then reopen later, changing in color, size, texture, remembering the ABCDEs, elevated growth, some things that look wart-like, and then large brown areas with some dark areas, just kind of thinking about different colors. So all the things that increase your skin cancer, the top three things, the top three on this list: exposure to ultraviolet rays, which is from the sun, and/or tanning and sunburns. Those are kind of like the three most modifiable risk factors. So like you can reduce the amount of times you get sunburnt by sun protection. So those are the things that you can do every day to help lower your risk. Everything else is kind of harder to change, right? Can't change your age as much as maybe we want to. You can't really change your skin tone naturally. Weakened immune system, having many moles or atypical moles. Some people are just born with a lot of moles, but there have been good studies that show if you have over 50 large moles, it increases your risk of melanoma. Having a personal history of skin cancer can make you prone to other types of skin cancers or other cancers. A family history, if your family member has had melanoma, there's an increased risk for you to have melanoma. And then radiation exposure, and if you have an organ transplant. Those are kind of the non-modifiable things you can't really control, but put you at a increased risk of skin cancer. So we'll talk about the kind of the top three: the UV rays, indoor tanning, and sunburns. It's a really big topic. I'm trying to keep it as broad. But let me know if there's any questions.
I was about to ask you,
yeah.
You actually might get into it, so maybe I'll stop my question. I'll hint it away here. But you had mentioned like UVA and UVB rays, and obviously we know sunscreen can help protect you from those rays. Once upon a time, this may make me sound old, but once upon a time, some sunscreens didn't protect against both. For the most part, are all sunscreens now protecting against both?
Most are. It used to just be the UVB rays, but now you have to look for something that says broad spectrum. It should always be labeled that on the sunscreen bottle, and then that will cover for the UVA as well.
Yeah.
But most of them now default to just broad spectrum, but they still label.
You would hope that they would. But I remember once upon a time you had to like really check the bottle and make sure it said the broad spectrum.
Because the two different rays, and we'll get to it, but they both kind of affect the skin differently, but they work together to increase your risk of skin cancer.
Right.
I think that's in the next few slides. But basically, the two things you can do to lower your risk is to prevent and to early detect. So we'll go through a few prevention things and then what you can do to help yourself get these lesions spotted early. So prevention, the big thing is to limit your sun exposure. Obviously, it'd be awful being inside 24/7 in the shade or not living your life. So when you do go outside, you just need to practice sun safety. And the big thing I just want to highlight, and I'll scream it from the mountaintop, is just avoiding indoor tanning or tanning beds as a practice altogether. So a lot of information on this slide. I'm going to try to keep it as understandable as possible. So let me know, Maddie, if I need to re-explain anything. Okay. We're just going to talk a little bit about what UV radiation is, right? So it's the energy that's produced from the sun, or it's emitted from tanning beds. And it is the energy that comes down. It enters the atmosphere. There's more than one type. So there's UVA and UVB. Those are the ones that reach the surface. There's some that live in the atmosphere that are like our atmosphere protects us from. But the bad part about UV radiation is that it's a light, it's on the spectrum, but we don't necessarily feel it all day. Like when you have a nice cool day like it is out today, you're not really feeling the heat of the sun, but it's still there. So it can damage the skin without us ever becoming warm. And when we can feel it, then it's kind of too late if you think about it like that. If you're really feeling that sun coming down on you, that means there's been a lot of kind of damage maybe that's gone unnoticed, especially if you went out with any like protection from the sun to begin with.
Yeah.
The first one is UVA. It's the most common type, the largest percentage of the UV radiation that comes to Earth, and it damages cells deeper into the skin. So if you look to the image on the right, the orange arrow, it's going to go down through the layers of the skin. This UVA is the same strength level no matter what. During all daylight hours throughout every month of the year, it is the same level of strength all the time. So even in the clouds, like it is today, you're getting some UVA. If you can see daylight, UVA is coming down.
Mm-hmm.
And this also goes through windows and glass. So if you're like, well, I just, like I spend most of my time in the clinic, but like I have an office that has windows, then if that UVA is touching me through the windows and the glass, it can still cause sun damage.
Mm-hmm.
And then you have UVB. That's about 5 or 10% of the UV radiation that comes to Earth down to the surface. It causes genetic changes at the top level of our skin, so the yellow arrow.
Mm-hmm.
This is the one that fluctuates based off of your geographic location, the time of the day, and the season. So this is kind of like when they talk about UV index, like how strong is the sun going to be today? They're talking about UVB most of the time, and you want to go kind of out when UVB is kind of at its lowest, right? So if you think about this, the northern hemisphere of the world, April through October, 10 to 4 p.m., that's going to be when it's at the strongest.
Yeah.
But this does not go through windows or glass, so you can sit in your office and not get any UVB. And this is the ultraviolet radiation that does produce vitamin D. So that's where they talk about getting vitamin D from the sun, and that's through UVB. But they both kind of act on the skin differently. So UVA, I think UVA, A for aging. So this is the like ultraviolet that's going to cause premature aging and wrinkling.
Mm-hmm.
And then UVB is burning, B for burning. This is what's going to cause you to burn or tan. And because when you're burning or tanning, you're causing more damage. Usually UVB has a stronger skin cancer relationship, but UVA still causes genetic changes. So it's like the compounding effect of both UVB and UVA together that increases the risk as well.
Yeah. I was wondering if you're going to use that little, I've always had heard that like UVA is aging, UVB is burning.
It's just a good like mnemonic to remember like what is causing this. If you get a really good sunburn, you can blame UVB.
Yeah.
But they're both present all year. So 80% of the UVA can go through clouds. So again, if you're in daylight hours through the cloud covers or when the sun isn't out, you're still getting exposed to this UV radiation. Higher altitudes, there's a thinner atmosphere, so there's actually less UV radiation that is blocked naturally from our atmosphere. And then it reflects off of surfaces, so like water, ice, snow, and sand. So even if you're kind of in the shade, but you're sitting somewhere where there's snow or you're at the beach and there's sand and you're under an umbrella, it can reflect back. So thinking of Boone, North Carolina in the winter, where we're at higher altitudes and it's snowing or ice, you're just even at more risk during those daylight hours. So the winter doesn't necessarily mean it's safer from a sun exposure standpoint.
So wear your sunscreen while you're skiing.
Yes, and cover up
everything.
I have like 3 slides on sunscreen because as you had, like there's just a lot that goes into sunscreen, and it's super important and it's super easy just to do it every single day. But both types of UVA, ultraviolet radiation, is a human carcinogen, meaning it's going to increase your risk for cancers. And then the most of melanoma can be attributed to just UV radiation exposure. So again, just daily different habits that you can incorporate just severely reduce your risk of skin cancer.
Yeah.
Okay, so we're going to talk about tanning. super preventable. This is tanning naturally or in a bed. So what is a tan? So the tan is just an exposure to radiation that causes damages on the outmost part of our cell. The tan comes from when we get exposed to UV radiation, our body just naturally tries to increase the melanin in our body to absorb all that radiation. And then since the melanin is what gives skin color, you have increased melanin, so you have a tan. That is what it is. And then it absorbs all the UV radiation, and then it'll fade over time as that goes away. I'm about to hurt a lot of people's feelings probably, but there's just no such thing as a safe or healthy tan.
Thank you for saying that. I have
Yeah.
said that before and no one believes me. Or people
Yeah.
say they need a base tan or like these, I don't even know.
Look at this. A base tan is another sign of skin damage. Does
Boo,
not
yes,
protect
no
against
fun.
sunburns. The glow of a tan is just the product of having all this exposure and skin damage. And it does not, like the base tan does not protect you against sunburns. It's just essentially just exposing you to more like UV radiation. And then all this kind of repeated exposure can cause visible damage over time. So again, UV A for aging, causes wrinkles, age spots, and then you can lose skin firmness. And then over time, with no protection, your skin can actually get real thick and leathery.
Yeah. Yeah.
Most people will be like, well, I won't go outside and I will just go into indoor tanning beds. And that is not a safe alternative at all. So tanning beds still emit UVA radiation or rays. So same thing that the sun does, just in a tanning bed that's artificially made. Same thing like going out in the sun, it does not protect against sunburn. It just exposes you to more harmful UV rays. It is not an effective way to get vitamin D because, again, vitamin D comes from UVB and the indoor tanning are UVA. So you can't even get vitamin D extra from that. It increases your risk of skin cancer, like it is proven. So if you indoor tanning and it takes like 1 or 2, I'm not talking like, oh, I get 10, after my 10th one I start to get damage. It's after the very first one. You can have a 50% increased risk of squamous cell carcinoma, a 24% risk for basal cell carcinoma, and then they've shown that the use of tanning beds under than 20 years of age increases your melanoma risk by 47%.
Oh my gosh.
So,
I'm
yeah,
just
that's
sitting
almost
here,
doubling your chance of
I'm
melanoma.
sitting here thinking about when I was in high school and everyone went to the tanning bed like before prom. Or that was even one of the questions that we had here. Where is it? If my teenager tans once or twice before prom, is it really that big of a deal? And yes, it
It
is.
is. Yeah, it all sun exposure, and I have a slide on this, is cumulative. So it adds up. It's not like, oh, I had one burn and it healed and then I'm back to 0. It's like you get burnt, you heal, and then you have that increased risk. And then you burn and then you heal and you have more risk. So you just like gather things as you gather risk as you tan and burn. Another alternative is to fake it. Don't bake. So self tanners are a way to look tan without that increased risk of skin cancer by causing all that damage. I'm not advocating that all self tanners don't have some inherent risk, which is the chemical compounds, but there's no increased risk because you're not getting all that UVA radiation.
Yeah.
So fake it, don't bake. It works well. I did one when I was in a wedding, and they have all these mitts you can apply now, and it looked to me natural. As someone who can't even tan to begin with, it was the most tan I've ever been in my entire life.
I think self tanners have come a long way too. We were talking about earlier how sunscreens have changed a lot and they're much more friendly for everyday use. But I think tanning lotions and like tanning like mousses, the ones that foam,
Yes.
they
Yeah.
really have come a long way and they're not orange like people
No.
may have once thought, or
Yeah,
maybe what they
it was
used
like
to
a
be.
sun-kissed glow. It was like getting the glow of the tan
Yeah.
without having to sit outside. So it was effective.
Yeah.
Okay. And then we're just going to touch on sunburns. I know most people know what a sunburn is, but again, it's just that prolonged sun exposure that causes damage to your cells. It becomes red, swollen, painful, can range from mild or blistering. People who are at more at risk, going outside in the middle of the day, or where those UVB rays, right? UVB for burning. Those are the ones that change throughout the day. So 10 to 4 o'clock, highest risk. So that can increase your risk for burning, or an overcast day where people think, hey, I'm not getting any sun. There's not the sun out. I'm fine, but you're really not. Thinking of those skin types, right? The Fitzpatrick, if you're more to the ones or the twos, right? Light skin, blue eyes, blonde, red hair, more prone to it innately. You just have less melanin. If you've had a sunburn before, you get sunburn again, increases your risk. And then staying in tanning beds too long, actually there was a statistic I was reading on like the American Cancer Society about skin cancer, and it was like 300 ER trips are from burns or injuries related to indoor tanning. So it actually just like causes bad effects.
Oh.
And I'm guilty of this. I will say a light pink burn isn't that bad. You know, like, oh, I just got a little bit red. But no matter how mild, every burn is a sign of injury to your skin that can result in premature aging and skin cancer, right? Because I was trying to say, sun damage is cumulative. Every time you tan or burn, it damages the DNA on your skin. The more you damage your DNA, the greater risk of getting skin cancer. So it literally just takes that first one and then increasing it throughout your age. It just accumulates every time you burn. So 5+ blistering sunburns by the time you're 15 or 20 years of age increases your skin cancer risk. That's supposed to say by 68%, and then melanoma by 80%. So if you start tanning, that's why protecting kids when they're so young and just getting like good habits for sun protection when children are younger will just prevent this cumulative effect when they're older. Okay, so what happens to the skin? So this is called photoaging, right? Or premature aging of the skin. Talked about this a little bit. But it becomes thick and leathery. You can get earlier than normal freckling, loss of that collagen, which is what causes wrinkling, fine lines, sagging skin. Things called telangiectasias or spider veins, which is that bottom photo. Basically, the sun damage can cause little blood vessels to burst, and you can get that red kind of streaking in the skin called spider veins. Doesn't necessarily happen just on the face. And then you can get brown spots. They're also called age spots. They're also called liver spots. They're called sunspots, but just like bigger, kind of, this is that top photo of just all these kind of brown spots on the skin just from the sun. So how can we limit our UV exposure, right? First and foremost, daily sunscreen, SPF 30 and above, and you got to reapply. I have a whole thing on sunscreen. Seek the shade during those peak hours. So again, if you're outside and you're a worker, you just need to make sure you work outside, just like make sure to cover up or take breaks in the shade. If you're outside playing at the beach, just make sure you have good sunshades, umbrellas. Think of protective clothing. So actually they've gotten really savvy about protective clothing, not just wearing long sleeves, but actually things that have UPF, which is like ultraviolet protective factor built into the skin, which is kind of like, if you think about SPF, it's kind of UPF for the clothing. It actually innately comes with some sun protection. Thinking of broad brim hats, covers your eyes, your face, your ear, your neck. Sunglasses, covers your face and eyes. I didn't talk about it. There you go.
I carry my hat with me everywhere.
I think bucket hats are even in style now, so you can totally just wear it and be fashion forward. I love it. It's really cute.
This one's nice. It like kind of folds up nicely. I can just kind of do this, and I put it in my purse. So,
and then sunglasses, really thick, wider rimmed glasses. Didn't talk much about it, but sun cancer or sun exposure can actually cause like cataracts and like sun cancer around the skin of your eye too. So that just helps protect that, because you can't necessarily put sunscreen that close.
Dr. Frederick, I did want to give you a time check. We are.
Yes, I know.
I know. We had too much fun. We talked too much.
Okay, I'll go through this.
45. I'll let you go through it quickly, and then if anyone is able to still stay on, like please stay on. And I just wanted to give you that.
Thank you. Appreciate it. Okay, so sunscreens. Who can use it? Everybody, except for babies under 6 months. I will talk about that. You want to use broad spectrum SPF 30 or above. Lotion and creams are a little bit better than the spray because you can really kind of rub it in and get a clean layer. The when I think is the hardest. So it really should be daily. It should be 20 or 30 minutes before going outside. And the real kicker is that you have to apply it every 2 hours or after you go swimming or you sweat a lot. So if you're outside at the beach and you're out there swimming, every time you come out, you should just reapply because the water is just going to wash it off, even if it is water resistant. And just thinking about daily sunscreen, I think we talked about this, reduces melanoma risk by 50% and squamous cell by 40%. So again, super easy, and it reduces literally your risk just from the things you can modify in half. You should apply it to everywhere sun will touch. And then how people severely underutilize how much sunscreen they're supposed to put on. So if you think about like 1 ounce is a lot in terms of this. It should be applied to your entire body for each application, or I think about like a teaspoon per limb. So honestly, a bottle of sunscreen should not last you all season, which it does sometimes in my house. It should last you like maybe a family of 4 should go through a bottle like in a few uses of it.
Yeah.
Okay. And then when you choose a sunscreen, there are 2 different types. There's chemical ones which absorb the UV rays before they can damage the skin. Those are the ones we're most familiar about. And then there's those physical ones, which are mineral based, usually titanium dioxide or zinc oxide, and they reflect. So they kind of like form a cast over the skin and reflect everything up. Mineral ones tend to be less irritating to the skin. So if you're prone to sensitive skin, think about a physical sunscreen instead of a chemical one. They can be water resistant. Again, I would think about using this if you're going to be intensely exercising or going into water. It's effective for 40 to 80 minutes, depending on what you're doing or how much you're sweating. Broad spectrum, protecting against both types of UV radiation. Should be an SPF level of 30 or higher. Again, sensitive skin, physical formulas are less irritating. And then the best sunscreen is one that you're going to wear every day. Like I wear it every day in my face moisturizer. It has built-in SPF 30 in it. That I'll use kind of on my head, and then I have one for my body that I'll just put on every day because I'm usually in shorter sleeves. So I just want to make sure my daily use I'm getting protected and slather it on. You could not put too much sunscreen on. So whatever you pour out, use it. Okay, really quick on SPF because it's really confusing. So SPF is not the time that you're exposed to the sun that it's effective for. It's like the amount of sun you're exposed to. So it's literally a measure of how much UV radiation is required to produce a sunburn. So the higher your SPF, the higher your level of protection. But thinking of your exposure of sun at 9 a.m., right before big sun hours, your SPF is going to last longer because your exposure or the intensity of the sun is lower than if you go out at 1 o'clock. That same SPF might only work for like 15 minutes because you're exposed to more sun. So again, and it's affected by your innate skin type, how much you apply, and the frequency that you reapply. But in general, if you're just going outside, walking the dog, driving to work, sitting in your office with windows, SPF 30 works. If you're going to be outside for extended hours, hiking, running, swimming, you work outdoors, you should do SPF 50 and above. Okay, we're almost done. Early detection, 2 things: regular self-skin exams and annual exams by physicians. Those are 2 ways you can look at your body and get things that are kind of concerning examined. So self-exams, about half of melanomas are self-detected. So you guys are better than us, or you will notice things sooner about your own bodies than I will. Because when you come and see me, and the first question I'm going to ask you about a spot on your skin is, well, how long has that been there? And it's really nice when someone's like, oh, it's been here for 2 weeks, or this is new about it. So if you're doing regular exams, it's much easier to notice when something's different. You want to do it once a month in bright light, a full mirror, so you can look at your entire skin, on your back or behind your ears, so using a little hand mirror so you can kind of look at those harder reach places. Taking photos. If you know something's different, or you're like, hey, I haven't noticed it, take a picture of it, and then next month you can compare and see if there's been any changes. So you can look back at photos or bring them with you to appointments to see doctors, and get a family member to help. I have my fiance, he'll help look at my back because I can't see that. So he'll help me know if there's anything changing. Great way for to be involved and maybe make it less judgmental or pressured to get something checked if you're kind of involving a family member.
Yeah.
And you should look everywhere: scalp, palms, soles of feet, in between toes, genitalia, things that also don't touch the sun, right? Because it will go everywhere. And then annual physical exams. It can be done by a family medicine doctor like me or a dermatologist. We will also do a head to toe exam. Just remember to remove nail polish, remove your makeup, wear your hair down so we can look at the nail beds. We use something called we use a technique called dermoscopy, which is where we use a dermatoscope, which is what I just popped up on the screen. And it's basically a magnifying glass that lets us look deep at skin lesions to see if there's any concerning features that aren't visible to the naked eye. And we can take biopsies. And again, it's super easy just to take various types of biopsies. So we can shave it off. We can remove a piece called a punch. If it's like an abscess, we can incise it and drain stuff from it. And then if it's a bigger lesion or concerning, that's where excision comes out and we can remove it. And then, like Maddie mentioned, At Family Medicine has a specific procedure clinic where you can come and get a skin check and biopsies same day. We're happy to see you just in our normal clinic every day to take biopsies if we need to. Again, it's super easy to do.
Mm-hmm.
And then when to see a health provider. If it looks new, changing, or odd, just get it checked out. The peace of mind, instead of sitting there and worrying about it, and then something could have been done earlier, it would be easy for me to say, yes, let's, take a piece of it, or no, let's just watch it for now. It takes, a whole body skin check can take like maybe 10 minutes. So
Yeah.
something super easy. And then real quick, adolescence, like we talked about, cumulative damage starts when you're young, and young skin is less able to protect itself from injury, including the sun. We talked about how just one sunburn can double your chance of a melanoma. So most of the same rules apply to adults as they do children, right? Apply sunscreen, wear a hat, dress in cool, comfy clothing that covers you, limit your sun exposure, seek the shade, and just remember to hydrate. Kids can get really dehydrated from just prolonged sun exposure. The only caveat is infants under 6 months of age. So you just want to minimize the sunscreen use, which sounds super counterintuitive to everything I've told you this entire PowerPoint.
Yeah.
But sunscreen use in infants under 6 months of age there's just a greater, maybe a risk for side effects. They're just more sensitive skin, so it can cause rashes. Sometimes it can just be a little harder to metabolize ingredients that young. And then those physical sunscreens can actually trap sweat in, and it's already hard for young kids to regulate their temperature. So that can also protect it in. But if this is the best option, then you can use a little bit of sunscreen. Just make sure it's broad spectrum. Physical sunscreens are a little bit better. And then you want to make it water resistant and SPF 30. But the best thing to do for children and children under 6 months of age is just keep them out of the sun. Wear long clothes, put them in a shade, an umbrella, pop-up tent, a stroller canopy, just as much as you can. That's probably the best thing to do with children. Mm-hmm. Okay, key takeaways, super common, skin cancer, cumulative damage adds up over the years, reduce your sun exposure, protect early, daily sunscreen, everyday hat, clothing protection, keep it in your purse like Maddie, and then just see a healthcare provider at least once a year for a skin exam. Those are my references. Sorry.
Awesome. No, you're good. It was great. You covered a lot, and maybe we need more time for our health talks, but I very much enjoyed that. We did have one question in the chat. Yes. You're welcome to stop sharing your screen too if you want to start sharing your screen so they can actually see you. Yeah, so this person said, are there any plans in the works to offer the free skin cancer screening that APPRHS had offered several years ago? And Dr. Frederick, I think you and I both weren't here during that time.
I think so.
But from what I have heard and what I know, I think we used to partner with Boone Derm a few years ago to do a free skin cancer screening. And I believe we're not necessarily partnering with Boone Derm anymore, but Boone Derm did do a free skin cancer screening just this month in May. I think it was on May 16th or something like that. So for the person that asked this question, be on the lookout in years to come, because Boone Derm's right next door here to Watauga Medical Center, so they do a free screening.
Maybe we can offer something like that at family too. I could talk to our administrative here, or see if that's even possible. Because I would be down for that. I think that would be super helpful, just because it's so hard to get in a timely manner, just because it is Boone Derm, and then until kind of I think At Family got up and running, from my understanding, there wasn't really much else in the area. So I think we're a good resource too that can help kind of make that more feasible, maybe more than once a year.
Yeah, for sure. Since we're totally over time, I will not ask these other questions that were submitted before, but you did answer a lot of them throughout your talk. But thank you so much. You did a great job. And thank you to everyone who's attended. I've noticed towards the end here, people have dwindled off, which makes sense because I know you you need to leave at 1, right? So,
You're good,
um,
yeah.
yeah, so well, thank you so much. That was great. I'm going to share my screen really quick, and this is just for more information on Dr. Frederick or App Family. You can scan this QR code. Thank you all for joining, and we look forward to having you join us next month in June. We'll actually be talking about a balanced diet and nutrition. So
You're really good.
fun stuff with our dietitian here at the hospital. So, anywho, but thank you so much, Dr. Frederick. You did great, and I really enjoyed getting to talk to you and hear from you.
Yeah, thank you. This is super fun. I appreciate the time.
I'll leave my screen up here just in case people want to scan it or um, have any additional questions. But
Excellent.
thank
Well,
you.
thank you. I'm gonna get ready for clinic. I'll
You're
see you around.
Bye.
Bye.
Thank you, everyone, for joining.